how the products have helped you. Sorry, I just pressed record. I should have done that earlier. Yeah, Caroline, over to you.
Right, hello everybody. I'm not very good at this. I'll apologise in advance. But I've been on the Omegas. It could be about 8 months. Yeah, it doesn't seem as long as that, but it probably is. And I really struggled. I've had a liver and kidney transplant. So the problem I have is any other health issues I get, they try and say, oh, it's because you've had a liver and kidney transplant. So to cut a really long story short, I've recently also been diagnosed with ME and fibromyalgia, which has taken years to get diagnosed with because I've got a transplant. Like I said, they try and put everything back to that. And then I started getting menopause symptoms, and I didn't really sort of think about having the menopause because I'm only 46. And like a lot of families, we don't talk in our family. So nobody really explained the menopause to me, especially my mum, bless her. All I know about my mum's menopause is she's been doing it for 20 years, bless her. She's 72 now. And so I'd gone to the doctors, and the doctor had said to me, I'll do some blood tests. He'd done the blood test, they'd all come back normal. So he said, well, you can't be going through the menopause. And then I can't even remember how it happened, but by chance I came across Zoe's group. And I started to think about it, and I thought, do you know what? I'm getting the hot flushes, the night sweats, the moods, all those sorts of things. I thought I must be going through the menopause. And I saw loads of people had raved about the Omegas. And because I've had a transplant, I have to be really careful what supplements I take in case they interfere with that side of things. So I thought, after talking to Zoe, and she told me how good they were, I thought I'd give them a go. So I spoke to my transplant team and said, yeah, that's absolutely fine. Give them a go. We'll check your bloods and make sure it doesn't interfere with them. So I've been taking them about 8 months. The first 2 months, I didn't really sort of notice much difference, apart from I wasn't waking up in the morning with a wet bed, for want of a better word. I wasn't getting the night sweats anymore, which even after you've been with someone 16 years, that's embarrassing when you wake up and the bed's soaking. So I noticed that. I noticed the hot flushes had calmed down. So I had a conversation with my mum, even though we don't really talk about it. I said, how often do you get hot flushes? Because I was sweating all the time. And that's calmed down. About a month or two after that, I noticed my appetite wasn't what it used to be. So I assumed that that's got to be the Omegas again, because I love food. I never stop eating. That's why I've been on Slimming World more times than I've had hot dinners, to be fair. And then obviously I got diagnosed with ME and fibromyalgia. Now, fibromyalgia is absolutely horrendous. I don't know if anybody on here has got it, but the pain you're in constantly is just unbelievable. It's like having the aches you get with the flu, but 100 times worse. And you can't stand being touched because that hurts as well. And then in the last month or so, I would say I've noticed that they've actually calmed down. And at first I thought, because I take codeine for the fibromyalgia, I thought, do you know what, it's codeine. But then I thought, I'd read somebody else's comment on one of the sites about taking the Omegas for fibromyalgia. So I stopped taking the codeine. And I realised that actually the pain had gone. I was waking up in the morning, I was like, I'm not in pain this morning, and I'm not taking codeine. So again, it's got to be the Omegas. The other things are like just the usual things. I'm not as moody as I was. I'm not biting my partner's head off every 5 minutes. But no, I love being on them. I think they're amazing. I really do.
Oh, bless you, Caroline. Thank you so much for sharing that with us. I know when we spoke the other day, because I don't even think I knew that you were suffering with fibromyalgia, and you said to me that you'd stopped taking your codeine, and actually it was fine. So I mean, that's incredible, because obviously taking codeine regularly is not good for your health, is it?
No, it's not good for you, and coming off it's even worse, to be fair.
Yeah, I can only imagine. So that's absolutely incredible. So thank you so much for sharing your journey with us. That's very inspirational. And again, it's a testimony to the products, how amazing they are, the Omega capsules. So thank you so much. So I'm going to hand over now to Julie. As I mentioned, Julie is a qualified nutritionist, and she's kindly agreed to come on the call and give us some of her expertise. So over to you, Julie.
Thank you, Zoe, and thank you, Caroline. That was an amazing story, not a story, testimonial. Just fantastic the way that it's turned around your health, which is, like Zoe said, very, very inspirational. So well done. So yeah, as Zoe said, thank you, Zoe, for inviting me tonight. I'm a band registered nutritionist. So BAND stands for British Association of Nutrition and Lifestyle Therapists. I specialise in female health and hormones, but have got a vested interest in perimenopause and menopause, as most of you on this call probably are, a fellow menopause sufferer. Like Zoe, exactly the same story. I was struggling with just about everything. I was the person, when I started work at 18 years old, sat in an office full of 50-year-old women, opening windows and then having fans, and I was like, it cannot be that bad. And I think karma came to bite me on the bum, because yes, it is that bad. And actually, one of the worst symptoms for me is the hot flushes and night sweats, and still is to a point. I've got it under control, and I'll explain a little bit more about recognizing the triggers as I go through what I'm going to talk to you about. But actually, just going to some statistics, 70% of women in Europe experience hot flushes and night sweats. 15 to 20% of those describe them as being very troublesome. They're the things that, some of the other things you can probably hide. Whereas if you're, sitting in the middle of a meeting at work and you're having a flush and you're just dripping in sweat and you go really red in the face and you just don't know where to put yourself, because it's not just getting hot. It's sort of a feeling of intense heat. When mine were really bad, I used to feel sick. And then afterwards you get like a chill and a shivery feeling. So you go to the opposite end of the scale where you can't get warm, and it's horrible. And if you're getting them like several times a day, to just try and get through the day can become pretty unbearable. And then if you're getting them at night as well, then you're not sleeping well. You're getting broken sleep. Like Caroline said, you're waking up in a cold sweat. It's embarrassing, as much as, if you've got supportive people around you, your partners or husbands, try and understand. It's difficult for them because they're not the one experiencing it. And I think unless you've experienced it, it's like anything in life, you can empathize, but unless you've actually experienced something, then you really don't understand what it's like. So I just wanted to go through a little bit of physiology with you first as to what's actually happening in the body. So basically, where the menopause is a natural transition, a natural stage of life. And we liken it to a second puberty. So in puberty, you're going through lots of hormonal changes, your body's changing, your body shape's changing. And that's because the sex hormones, estrogen, progesterone, testosterone, are all rising to prepare us for our reproductive years and for carrying a pregnancy. In menopause, it's just the opposite end of the scale. So in puberty, they're going up. In menopause, they're coming down. And estrogen, the main hormone that's released by the ovaries, goes into decline because the ovaries only have a finite number of eggs. And so when you sort of come to the end of your egg stores, it's the estrogen that prompts the ovaries to release the egg. And it's the progesterone that then is what we call the pregnancy hormone, because that sort of thickens up the uterus lining and the womb to prepare to carry a pregnancy. So they're the two main hormones that go up and down throughout your 28-day cycle, or whatever your cycle length is. So the first thing you're probably going to notice, as Caroline said, she thought she was too young, 46 years old. The average age where menopause starts is between 45 and 51 years old. The bad news is, yes, as Caroline said, her mum's been experiencing it for 20 years, and the average time length that menopause lasts is 15 to 20 years. And a lot of people talk about getting through menopause. You never get through it. It's once you're in menopause, you're in it for the last third of your life. The good news is a lot of the symptoms are manageable. A lot of the symptoms are only temporary, and hot flushes and night sweats are no different. So the main thing is with hot sweats and night flushes is that decline in estrogen affects what's called the thermoneutral zone in the body, and think of it like your body's thermostat. So all of a sudden we get a lot more sensitive to temperature changes, and that's all that's happening. The sort of thermostat in your body just goes a little bit out of sync and just can't cope with the temperature changes. And so if it's sort of that you're getting the sweat, it's just because it's just got too sensitive, and that's sort of the body's reaction. So we call hot flushes and night sweats vasomotor symptoms. So you might read some articles or see some blogs or things on the internet that don't describe them as hot flushes and nights, but vasomotor symptoms. The reason for that is what creates the flush is a dilation of the blood vessels. So when you sort of get a rush of blood, the blood vessels widen to allow that blood to pass through, and then when they constrict, then the blood vessels tighten up again and the blood pressure drops. So those two mechanisms are called vasodilation and vasoconstriction, which sort of ties in with the vasomotor symptoms. So the main cause of the hot flushes sweats is the decrease in estrogen, and estrogen is a very anti-inflammatory protective hormone. So it's when the hormone starts to go in, if the estrogen starts to go into decline, it's where we start to get the hot flushes, night sweats, the joint aches and pains, because all of a sudden we've lost that protective anti-inflammatory property of the estrogen level. So there are triggers for hot flushes and night sweats. And like I said at the beginning, I know my triggers now. So if I avoid my triggers, then I know that I can pretty much manage them naturally. There's things that, you know, I do enjoy the occasional glass of wine, and alcohol is one of my triggers. And coming back to alcohol will cause a vasodilation because it's a stimulant of the blood vessels. So that's the reason why it can trigger hot flushes and night sweats. So once you get to know your triggers, you can generally manage them a lot better. But one of the massive drivers of them is stress. And if you've been on any of my talks before, or if you see anything I put on my Facebook page or every talk I do, the top of the list is stress management, because as a nutritionist, everybody thinks it's all about food, which it is to a level, but it's food, diet, lifestyle, and also sort of like, if you're into that side of things, the holistic approach is the spiritual mind body sort of approach. So when we get stressed, so when the ovaries stop producing eggs, it's the adrenal glands that take over the main production of your estrogen. And it's your adrenal glands that are your glands that produce cortisol, which is the stress hormone. So if you're chronically stressed, then your adrenal glands are going to be way too busy producing cortisol to produce any levels of estrogen that are going to be adequate to control your menopause symptoms. So managing stress is key to managing your symptoms, and that's all the symptoms of menopause. So because cortisol is the survival hormone, your body will always prioritize that over any other sex hormone. And as you've probably heard of the fight or flight response when you're stressed. So that's your body's survival instinct. And so because your body just knows that physiological response is going on in your body, so regardless of whether, you know, in primitive man times it might be a saber-toothed tiger about to eat him that was the danger. So absolutely right, you want the glucose to release from the muscles to help them to run away from the danger. The blood thickens because they think they're going to be injured, and so, you know, they don't want to bleed to death. So there's all this physiological process going on in the body as a survival instinct. So it's no different to you being stressed out at work or opening an email that upsets you, or, you know, you've had an argument with one of your children in the morning, and, you know, and just living in a stressful environment, driving that stress response all the time. So your body is going to be too busy producing the cortisol to keep you alive. So what it does is it shuts down any body system that it doesn't need. So it's going to shut down the reproductive system, because you're not going to be reproducing, because you're technically going to die. Your digestive system gets shut down because you're not interested in eating, because you're going to die. So all these things are going on in your body, and you know, very negatively affecting every other body system. So stress management is key. And whilst we can't always remove the source of stress, so if it's your job or your partner or, you know, your children stressing you out, then you can't just go, right, bye, thanks a lot. So we can't always remove the source of stress, but we can change how we respond to that source of stress. So, you know, getting strategies in place to help with that is a really, really useful thing. Exercise is also a stressor to the body in an acute scenario. But if you're under chronic stress and then you go out and do, you know, a high intensity class or a spinning class or running, you know, something that's going to like really raise your stress levels, then that can sort of compound the situation as well. So choosing sort of more relaxing, like things like yoga, Pilates, just sort of more stretching exercises, resistance training, so things that aren't as stressful to the body can help there as well. There's particular foods. So you've probably heard of yin and yang, the sort of Chinese versions of cool and warm. So we talk about the same things with food. So we've got yin foods, which are your cooling foods. So that's things like much of the things that have got very high water content. So cucumber, watermelon, lettuce, salads, you know, all your raw foods. And then you've got yang foods, which are things like your chilies, curries, spicy foods. They're generally a trigger for hot flushes. So avoiding anything too spicy, too hot, any foods that are sort of on the red orange spectrum are generally the more heating foods, and anything on the sort of blue green are the more cooling foods. So sort of really matching with what we associate with hot and cold. Caffeine is like my Achilles heel. I cannot drink caffeine at all. So I do enjoy a cup of coffee every now and then, but I'll have a decaf and I can tolerate that. There's still caffeine in decaffeinated coffee, but not to the level of a normal caffeinated one. And if I go out and I ask for a decaf coffee and it comes, I know 100% if they've not given me a decaf coffee, because I can guarantee within 2 sips I'm having a hot flush. It goes as quick as it comes, but it's just something that really drives my symptoms. BMI, so body mass index. Anybody with a high BMI, so we class that as over 30, you've got an increased body insulation, and because of this narrowing of the thermoneutral zone, that can actually drive hot flushes and night sweats. So one of the things I always recommend to people is, if you're not really sure what your triggers are, then just for a couple of weeks keep a diary and sort of monitor when you're having your hot flushes, and see if you can link it to any of those stimulants that I've just said. Alcohol is another one, and again, because it thins the blood, it sort of creates that vasodilation, so that's the reason that's a trigger. So one of the things Zoe's asked me to talk to you about tonight is what we can do naturally to help ourselves. So similar to Zoe, I was in a position when I started to get my symptoms, I hadn't qualified as a nutritionist then, and went to my doctor, and I was actually offered HRT there and then. But because of my family history and the risk factors in my family, I didn't want to take HRT. So I asked the doctor, well, is there something else, more natural therapies that I can take? And they basically didn't know and sent me off to look on the internet myself. Well, I'm sure a lot of you here have probably tried to trawl the internet to look for things in the past. And whilst there's lots of useful information out there, it's generally a one size fits all, which isn't tailored to you and your symptoms. There's generally a product at the end of it that somebody's trying to sell, and there's very conflicting information out there. So it wasn't actually the menopause that drove me to become a nutritional therapist, but through my studies and to become a nutritional therapist, I actually learned all the tips and tricks and dietary things that I was doing wrong that enabled me to then make the changes I needed to. And like I say, did manage to fix all of my menopause symptoms with no HRT. If you're not aware, and I'm not anti-HRT, but if you're not aware what HRT does, HRT is putting those hormones back in. So because the symptoms are arising because of a decline in the hormones, by putting the hormones back in, your symptoms are going to go. So great, happy days, it goes away. But if you're not fixing what's going wrong in the body, you can only take HRT for a limited time, 5 years safely. And after 5 years, your risk factors will increase for breast cancer and other types of cancer. But you've also got the protective effects that HRT protects you from osteoporosis and heart disease, which increases when you get into menopause, the risk factors there. But once you stop taking it, unless you've sorted out what's going wrong, then your symptoms are just going to come back. And the way the doctor explained it to me, because I was really struggling to hold down my job at the time and just couldn't really function at work, I was told, well, in 10 years' time, you'll be 70. And so it doesn't matter if you've got the symptoms then, you'll manage them better. But did I want to be going through this at 70 years old? No. So, it's kind of like you're struggling with it now, but at any age, you don't want to be struggling with the types of things that happens. Plus, the menopause is a very time critical window for health, because we're losing that protective effect of the estrogen. Then if you've got any sort of underlying health conditions, then it's really a time where it's a good time to really get to grips with your health. So I'm conscious of time, I'm going to push on into natural therapies. What I would say is always rule out any underlying conditions that you think there may be. Thyroid is the massive one that can get thrown out when there's any hormone imbalances going on. The thyroid also regulates your body temperature. So always get your thyroid checked. And I know that the NHS has got quite a high range of something like 0.7 to, I think it's 5 point something for thyroid stimulating hormone, which is pretty much all they'll test. But in terms of nutritional therapy, we work to optimal levels being 2 and above. So if you have had your thyroid checked recently and it's below 2, then it might be worth you going back to your GP or getting a private functional test, and you can get them done for about £75, which tests the whole of your thyroid health. So not just your thyroid stimulating hormone, but T4, T3, your conversion of T3 to T4. And your antibodies. So there are autoimmune diseases for thyroid as well. So I just wanted to throw that in there. So what can we do naturally? Hydration is key, especially if you are having hot flushes and night sweats, because the increased sweating, you're going to be losing water and you can become dehydrated. Stress management we've talked about. Identifying and removing triggers. Liver detoxification. So in order to detoxify old hormones efficiently, we need to have good liver detoxification pathways. So you need certain foods that help with liver detoxification. So you want foods that are rich in folate, B6, B12 and B2. And that's things like yogurt, eggs, fish, broccoli, spinach, avocado, oats, quinoa, rye, pulses, chickpeas, liver. Don't very often encourage many people to eat liver. They just go, no, thank you. Or the next one, offal. The clue's in the name, it's awful. Asparagus and lentils. So coming on to the essential fats. So Zoe's talked to you about the omegas, and there's a reason why the omegas work really well for this particular symptom of menopause. So omegas are essential fats, so essential because the body can't make them for itself, and so you can only get it through the diet or through supplementation. So the best source of omega-3 in particular is oily fish, so salmon, mackerel, anchovies, herring and sardines. They're your best sources. So anybody that doesn't like fish, you stuff straight away. So yeah, an omega supplement is the way to go. The reason they're so important is, as I say, they're essential fats because our body can't produce them, but we actually need cholesterol. That's a cofactor for producing hormones. And so for the production of our sex hormones, then they're absolutely essential. So when people are getting this type of results that, you know, Caroline's experienced and Zoe's got other testimonials from people, then the reason behind that will be because you clearly haven't got enough omega essential fats in your diet. And so by putting the supplement in, then that's going to be helping with your hormone production. The omega-3 in particular, and I know the omega supplement is 3, 6, 7 and 9. Is that right, Zoe?
It's 3, 5, 6, 7 and 9, so it's all 5 omega fatty acids. Yeah.
So they've very much got anti-inflammatory properties. So taking over from where the estrogen was your anti-inflammatory, then the omegas are really going to help with that. So that's the reason why you're going to experience, help with the joint and muscle aches and pains. Now, the only thing to remember is we've got another source of fat, which in the Western diet is way too high. So trans fats are found in all the nice things, the baked goods, the biscuits, the pastries, the cakes, spreadable butters, and they're the things that they're the types of fat that your body can't use. But if you've got a diet high in trans fats, then you're not going to be absorbing your essential fats, so your omegas. So you really need to make sure you've got a really good ratio there. There's other foods that contain something called phytoestrogens, and the reason that they're effective is because they can actually mimic the effect of estrogen in the body. So on our cells, we've got estrogen receptors, and so when you've got enough estrogen circulating and you're producing enough, that will bind to your cell receptors and your body knows it's got enough. When you're producing much lower levels, by incorporating phytoestrogens, they can actually mimic estrogen and they will block those estrogen receptors, so the body thinks the hormone levels are higher than they are. So the main sources of those are your brassica vegetables. So that's things like broccoli, kale, cauliflower, sprouts, and another really good source of those is flax seeds, and that's also a nice source of omega-3 as well. Just a couple of lifestyle tips. So loose layered clothing can help. So, if, like I said, you're going through this hot and then you go cold, so you can take a layer off and then you can put that layer back on. And really just removing as much processed food as you can from the diet. Sage tea has been shown to reduce hot flushes in some clinical trials. And also vitamin E, it's a really potent antioxidant. And there's a lot of research that vitamin E can actually reduce the severity of hot flushes as well. So although they might sound like really simple measures, and it really isn't as complex as everybody thinks it is, a lot of them can be really effective and just very simple, easy to introduce changes. And alongside the supplementation, then really, if you've tried all of that and you're still not getting to grips with these symptoms, then yes, maybe HRT is the route for you. But what I would always say is try everything you can possibly can naturally, and then hopefully there's no need for the HRT. And there's myself and Zoe and probably other people on this call that are testament to that. So thank you for listening, and yeah, if you've got any questions, if we've got time, then I'm happy to answer some questions, Zoe.
Lovely, thank you so much, Julie. Well, I think we've literally got, because the call will automatically end, I think, because it's only on, we've literally got a minute to go. So thank you ever so much, Julie. That was very, very informative and interesting. So I just really wanted to quickly just to let you know really what's the difference between our omegas that that we've been talking about to those others that are out on the market. And as Julie mentioned, ours have got all 5 omegas in, so the 3, 5, 6, 7 and 9, and ours are actually, they're not fishy either, so we source it straight from the algae that the fish feed on, and ours are also bioavailable, which means it goes straight into your bloodstream, and it's stored, which is why we get so many great testimonials. So these are really one of a kind, and that's why lots of our ladies are seeing such good benefits on those. So I think really with the call